Welcome to Slocum Center for Orthopedics and Sports Medicine. My name is Dr. Mick Koester, and I specialize in musculoskeletal injuries, concussion management, and pediatric and adolescent sports medicine. Testing such as MRIs and CAT scans is rarely used in the diagnosis of concussion, and that's because concussion is an injury that affects the way the brain works, not the way the brain looks. So if you break your wrist, we get an x-ray, we see what it looks like, and we can see that damage to the bone. If you injure your knee and tear a meniscus or tear your ACL, we may get an MRI and we can see what that injury looks like. With a concussion, it's a microscopic injury to the brain, which means that MRI doesn't pick it up, CAT scan doesn't pick it up. Now, there may be some things that are some signs and symptoms that are worrisome enough that makes us want to say, yeah, let's see if there's any bleeding or swelling in the brain. But that's rare, and that's what shows up on a CAT scan or shows up on an MRI. And this can lead to some confusion because people may go to the emergency department on Saturday or Friday when the injury occurs. Things are worrisome enough at that time that the emergency room physician goes ahead, orders a CAT scan, and then they're told that the CAT scan is normal. Sometimes people will misinterpret that the CAT scan is normal into that means the same as that there was no concussion. And that can't be further from the truth. Just because that CAT scan is normal just means that there's no bleeding or swelling in the brain. Doesn't mean that there's not a concussion. So it's important to continue to keep treating like we typically would with a concussion. As far as getting MRIs, sometimes MRIs can be helpful in the course of treatment for concussion. When I give talks to doctors and athletic trainers and other healthcare professionals and they ask me how often I get MRIs, my standard answer is the more concussions I see, the less MRIs I get. They're just not helpful for the most part. In rare instances they are, and sometimes I'll get them, but boy, it's few and far between because it just doesn't make a change with what our treatment is going to be. The best treatment for a concussion at this point in time is rest. Now, there may be some medical developments in the future and medications that come around, but right now, resting that brain is the best way to treat a concussion. And when we say rest, we don't just mean physical rest of that we don't want you running around and playing your sport. We mean what's called cognitive rest as well, which means rest from thinking, rest from not doing schoolwork, right at the time of injury, and also resting the brain from other distractions and other stimuli. And those important things are phones, video games, computers. So those are the things that it's really important to try and keep people away. Now, obviously this is not always easy in teenagers because that's what they're used to all the time. But it's really important that the parents emphasize the need to keep the kids off of those devices because that constant visual stimulation really tends to increase symptoms and we think can lengthen symptoms as well. Medication plays a role just in using Tylenol or ibuprofen as headache treatment. But aside from that, rest and sleep early on are really the most important things. An athlete can't return to play from a concussion until we know that they're completely resolved from the previous injury. And that's not easy. If you hurt your knee or if you hurt your ankle or if you break your wrist, we can press on that, we can test the ligaments, we can test your strength, we can look at x-rays. That gives us a pretty good indication that it's healed up and you're ready to go. Not so much with concussion. We can't take a look at your brain and see what's going on in there. So we have to look at a variety of things to be able to make that decision. There's not a gold standard or a blood test that we can do that tells us, yep, you're recovered. So we look at a variety of things. In high school age kids and older, we use what's called the impact test, which is a computerized test that lets us look at memory, reaction time, various neuropsychologic parameters. That test needs to be in the normal range. We look at the physical exam, making sure that balance and reaction time and strength is normal. We look at what the athlete or the injured person is telling us. What are their symptoms? Are their headaches gone? Are they no longer having dizziness? Do they feel back to normal? We also look at what their parents are telling us, what they're observing. If they still see some of those signs and symptoms of concussion that they were initially worried about, or if in fact they think that their son or daughter has completely returned back to normal. And as a parent of a child who's had a concussion, it's pretty easy to tell that difference from when they go from injured to getting back to normal. Getting the high school student back into the classroom following concussion can be a really difficult challenge. Obviously, for high school athletes, their job is school, and nothing affects your ability to do schoolwork more than a brain injury. It requires you to concentrate and focus and remember things. And when that concussion occurs, that really throws a wrench into things for the kids, so they can really struggle coming back to school. One of the important things that we're learning is to find middle ground. We don't want to throw them back into school 100% where they're expected to do everything, but we also don't want to keep them away from school for a week or 2 weeks and let them get so far behind in their classwork that they just are really struggling when they come back. So what we talk about is the concept of academic accommodations, and that's working with physician, athletic trainer, and teachers and counselors all working together as a team to put together a learning program that allows a student to maybe attend 1 or 2 classes a day to start with, then 2 or 3 classes after that. Maybe takes some of their homework and puts it into a pile of, you don't have to do all of this, or you only have to do 50% of it. Keeps them out of testing for a week or 2, and slowly allows them to re-acclimatize back into the school setting as their symptoms resolve. This can be very, very difficult, and at times there's other people that we get involved as well, people who have even more expertise in the school learning side of things. But the importance is to try and strike that balance between not doing anything and making accommodations in the classroom, especially during those first few weeks. Now, of course, there are some students who are going to continue to struggle for not just weeks, but struggle for months. That's when we get the school team even more involved and start looking at things like an IEP or a 504 plan, and making those accommodations either last for just a semester or sometime for the whole school year. But it really presents a lot of challenges.